Hello everyone, this is Kevin Kruse here with Texas Orthopedic Associates in Dallas, Texas. We're a division of Lone Star Orthopedics. Here today talking to you about shoulder surgery and some of the reasons why we use the devices and implants that we use in shoulder surgery. You know, if you choose to have your operation for your rotator cuff, some of the things you can do to prepare preoperatively, I think it's a good idea for everyone to learn how to do the exercises that they're going to need to do postoperatively beforehand. You're going to be less sore. It'll be fresh in your mind. I think you're going to bounce back quicker from the operation if you do those exercises and you know those exercises before we do the operation. And it's just going to make it easier with you with your therapy. Some of the other things to think about preoperatively, you know, looking at rotator cuffs and what's your life going to be like right after that operation? Well, you know, hopefully your pain's going to be pretty low because we do a nerve block right before the operation. We give you plenty of pain medicine to make sure that you can deal with the pain that you're going to have after the operation. If you look at like how much pain are you going to have after surgery, you know, I track everybody with a database, and in my database on my patients, what I see is that your pain just decreases after the operation at intervals up to a year. Some people do have a spike in pain more than they had before the operation, but most patients it actually just decreases. Other things to think about, you know, a common question I get is about driving. I tell everyone, you know, I let you bend at your elbow and move your hand. So as long as you're not taking narcotics, I'm okay with you driving as soon as you're comfortable to drive. Some surgeons may have other, protocols that they use for that. But for me, even if you have a sling and I let you bend and use your elbow, I'm okay with you driving. I'm okay with you traveling when you're ready to travel. I'm okay with you going back to work when you're ready to go back to work. As long as you're following the restrictions that we have, which is typically 4 to 6 weeks of no lifting of the arm. You can use the hand so you can type and do small and feed yourself and kind of bathe yourself. 4 to 6 weeks of no lifting of the arm, and then 3 months of no lifting more than a pound. After 3 months, you can get back to most of your activities. So those are the things to think about before you have surgery for rotator cuff and just trying to prepare.